COVID-19 wasn't close to the worst pandemic this world has seen. Before COVID-19, humanity had already faced numerous pandemics. Some of these were catastrophic, killing millions of people. From the Black Death to Spanish flu, pandemics have shaped human history. Let's take a closer look at the deadliest pandemics that devastated the world, each of which left lasting effects, some even transforming societies forever. In this video, we will explore these global health crises and their impacts. The first pandemic in the list is the Black Death. It hit Europe in the 14th century and killed about 25 million people. This was around a third of Europe's population. The disease spread quickly, carried by fleas on rats. These fleas were the main vectors infecting humans with the plague bacteria. The Black Death didn't just kill, but also caused widespread panic and societal collapse. The workforce was decimated, leading to labor shortages. As a result, feudalism began to break down, and the social order was disrupted. Economies crumbled, but this also laid the foundation for major social changes, which is why the Black Death is considered one of the deadliest pandemics in human history. Moving ahead to 1918, the Spanish flu emerged. This pandemic was caused by the H1N1 influenza virus. It spread rapidly and affected a third of the world's population. An estimated 50 million people died, making it one of the deadliest pandemics. What was unique about the Spanish flu was its impact on healthy young adults. Most flu strains target the very young and the elderly, but this one was different. It spread during the final months of World War I, aided by the movement of troops. The disease overwhelmed healthcare systems, leading to massive losses. The speed at which it spread, coupled with its deadly nature, caught the world off guard. Despite the name, the Spanish flu did not originate in Spain but was first reported in the United States. The next pandemic on the list is HIV/AIDS, which emerged in the early 1980s. HIV, the virus that causes AIDS, spread globally, particularly in sub-Saharan Africa. It was a new disease, and there was little understanding of how it spread. Initially, it was stigmatized, and misinformation made the crisis worse. HIV/AIDS is primarily spread through unprotected sex, contaminated needles, and mother-to-child transmission. It's estimated that over 36 million people have died from AIDS-related illnesses. Despite no immediate cure, antiretroviral treatments have significantly extended lives. Today, many people living with HIV can expect to live a normal lifespan. However, the stigma surrounding HIV/AIDS continues to complicate prevention efforts. The pandemic also spurred major breakthroughs in global health and infectious disease research. Another deadly pandemic was the third cholera pandemic in the 19th century. Cholera first appeared in India and quickly spread across the globe. It caused outbreaks in Europe, Africa, and the Americas. Cholera killed over 1 million people, with many dying within hours of infection. The disease is caused by a bacterial infection that leads to severe dehydration. Cholera spreads through contaminated water, and at the time, sanitation was poor. This pandemic was significant because it spurred advancements in public health. It led to the establishment of modern sewage systems and the understanding of waterborne diseases. By improving sanitation, countries were able to better prevent future cholera outbreaks. This pandemic demonstrated the critical role of infrastructure in controlling disease. The 1916 polio epidemic was another notable health crisis in the U.S. Polio primarily affected children and could cause paralysis or even death. In 1916, the epidemic infected more than 27,000 people in the United States. Nearly 2,000 people died from the disease, with thousands more left disabled. Polio spreads through contact with infected feces and can attack the nervous system. The 1916 epidemic spurred efforts to find a vaccine, which would eventually succeed. In the following decades, global vaccination programs helped eradicate polio in most parts of the world. While it has been nearly eliminated, polio still exists in some countries. It was one of the most feared diseases of the 20th century. The fight against polio remains an ongoing success story in public health. In 2009, the H1N1 influenza or swine flu pandemic emerged. The virus spread rapidly across the globe, infecting over 1.4 billion people. While the death toll was lower than other pandemics, around 200,000 people died. Swine flu primarily affected young people, unlike seasonal flu strains that target the elderly. This pandemic led to the rapid development of a vaccine. The response to H1N1 highlighted the importance of quick action and coordination in a pandemic. Governments and global health organizations were able to prevent more widespread fatalities. Swine flu demonstrated the need for continuous monitoring of new flu strains. It also prompted improvements in global disease surveillance systems. The experience gained from the swine flu laid the groundwork for future responses to pandemics. Lastly, the COVID-19 pandemic took the world by storm in 2019. The virus, caused by the SARS-CoV-2 virus, spread rapidly across continents. Within months, COVID-19 became a global pandemic, affecting millions of lives. The rapid spread was due to global interconnectedness and air travel. Countries implemented strict lockdowns, and healthcare systems were overwhelmed. Vaccines were developed in record time, but the virus continues to affect global health. COVID-19 showed how interconnected the world is and how fast new viruses can spread. While vaccines have helped control its spread, the pandemic has changed society in many ways. We continue to learn from COVID-19, and the pandemic remains a stark reminder of our vulnerability. The world's response to the pandemic has set a new standard for future health crises.